Hello, in this video we will be discussing what will be seen in a mid-shaft fracture of the humerus. So we have our anterior view of the humerus here in this picture on the left, and just blown up over here you can see it in the middle of the screen. The mid-shaft region would be somewhere in this area, but most likely the fracture would be somewhere right in the middle. So that'd be a mid-shaft fracture of the humerus, but remember that the humerus is prone to fracturing at the surgical neck as well, which we discussed could damage the axillary nerve. It can fracture at the supracondylar region, which is likely to damage the median nerve, or it could fracture over here at the medial epicondyle, which would be likely to damage the ulnar nerve. But let's focus now on the midshaft fracture. Now, what's likely to be damaged at the midshaft fracture would be a radial nerve lesion or a deep artery of the arm lesion. And we'll just focus here on what will happen with the radial nerve. So recall that there's a groove that runs on the back of the humerus called the radial groove or the spiral groove, where you'll find the deep artery of the arm or the radial nerve. So we know that the radial nerve is running just on the back side of the humerus. So if there's a fracture right here about halfway down the shaft, the deltoid, which inserts right about here, is likely to pull the proximal fragment away from the distal fragment, increasing the likelihood of damage to the radial nerve. But what would this look like clinically? Let's first remember what the radial nerve does. It provides sensation, so it has a sensory component, to the posterior arm, posterior forearm, and a chunk of the posterior hand. So a patient with a lesion here will most likely demonstrate numbness or loss of sensation over the posterior forearm and a portion of the back of the hand. What is the motor component? Well, remember that it innervates the triceps muscles, so the three heads of the triceps, medial, lateral, and long, as well as all of the muscles of the posterior forearm. And there are some smaller nerves that are branches of the radial nerve that innervate some of the more specific muscles, but they are all supplied by the radial nerve, and then that is largely responsible for extension of the elbow or the triceps and extension of the wrist from the posterior forearm or extensor muscles. If there's a fracture here at the midshaft, though, most of the triceps are likely to be spared. Specifically, the long and lateral heads are likely to be spared, which you can remember LL, while the medial head is not spared. So you'll see weakness with elbow extension, but not paralysis. That's not true for extension at the wrist. So none of the muscles of the posterior forearm that are innervated by the radial nerve will be spared. So what you'll see, something called wrist drop. And this is where you'll be unable to extend at the wrist or at the metacarpophalangeal joints, which are the joints at the junction between the fingers and the rest of the palm. Okay, and that does it for this video.